Hello, everyone, and welcome to Got a Problem with Your Knee? Ask Dr. P. My name is Adam, and I'm a VFit specialist here at Victory in Motion, the home of knee repair, not knee replacement. We are so excited to welcome you to our weekly show. We have a ton of questions that were submitted to our Skool group, Got a Problem with Your Knee? Ask Dr. P, our Facebook group, Knee Repair, Not Knee Replacement, and our social media accounts at Victory in Motion 1 and at Dr. Marc Pietropaoli. First thing is first, who is Dr. P? Dr. P is a board certified orthopedic physician, a sports medicine specialist, and a regenerative specialist. He is the founder and CEO of Victory in Motion, the creator of the creator of the trademarked knee repair, not knee replacement program. Victory in Motion's mission is to make the world knee replacement free by 2043. Yes, you heard that right. Knee replacement free by 2043. Dr. P has over 25 years in orthopedics and regenerative medicine, so he brings a wealth of knowledge every week to this show to be able to answer your burning questions. This week, we have a ton of questions about knee replacements. So without further ado, let's welcome Dr. P.
Adam, how are you?
Good. How are you?
Good
Turn
to
my
see you.
volume.
Oh, great.
Cool. So we got a bunch of questions this week about knee replacement surgery. So um, I'm gonna start rattling them off, and we'll go from there. Um, well, the first question is maybe not so much about knee replacements, but what is the hardest orthopedic surgery to recover from?
What's the hardest orthopedic surgery to recover from? I would say that most of the time it's going to be back surgery, even a little bit more than neck surgery. Some of these lumbar lower back surgeries where they're doing multiple levels of fusion and putting screws and rods and a lot of metal and hardware in there. That can take a long time to recover from. It can be very painful. Um, Knee replacement is a pretty painful surgery. So it's pretty painful in the beginning, even more so than a hip replacement. And shoulder replacements, I think, are some people who have had a shoulder say that's worse than the knee. Some people who have a knee say it's worse than the shoulder. So I think back surgery is probably number one. And we're talking elective surgery because obviously, if there was a trauma and somebody was in a car accident and they broke all kinds of bones, that's going to be a very painful surgery as well. But for elective surgery, probably back surgery, and then knee replacement, and then maybe shoulder replacement, at least in my experience.
Gotcha. Okay. Um, how long does it take to recover from a total knee replacement?
So it takes, usually we like to tell people it takes 3 or 4 months to get back to full duty type activities, but people can still improve 6 months, a year, sometimes even 2 years after a knee replacement because it's a big, huge surgery. This is what a knee replacement looks like. It's metal, goes on the thigh bone, then you have a metal piece that goes on the shin bone, a little plastic piece. And we don't really cut the entire knee out. What we do is we cut the damaged part off, and then this metal piece gets put onto the end. We cut the damaged part off and put the plastic and metal part on the shin bone and then the kneecap as well. And I say we because I did used to do these until we developed the knee repair, not knee replacement. And there's still, at this time, there's still a need for this occasionally. Not occasionally, there's quite a few people are getting it. But we know at least 1/3 of knee replacements are probably unnecessary at this time, at least. There's been studies that show that. So I have not performed a knee replacement since 2020 when we developed this knee repair, not knee replacement program.
Awesome. And there's different types of knee replacements. There's like partial, there's total. When would those be used, and how can knee repair, not knee replacement, help in those situations?
Exactly. So great question. So if we look at a knee here, and I hope you can see that, but here's the femur, the thigh bone, here's the tibia, the shin bone, and then the kneecap is underneath here, and then the fibula is the outer leg bone. A total knee replacement is going to replace the surfaces, we call them the articular surfaces, of the kneecap, of the entire thigh bone, so both sides, like I showed here, replace both. And then of the entire shin bone, that's a total knee replacement. You're replacing the surface of the entire knee. A partial knee replacement, or what we call a hemiarthroplasty, sometimes only the inner side is worn out. And I don't have a model right here. We have one in the office somewhere, but we'll only replace the metal on the thigh bone and the metal and plastic on the shin bone. And so that's a hemiarthroplasty. There's even procedures where maybe two out of the three, we call these compartments. So you have your medial compartment, which is on the inner side of the knee. You have your lateral compartment, which is on the outer side of the knee. And then you have your patellofemoral. This is your patella, your kneecap. This is your femur. So you have your patellofemoral compartment. So there's three compartments, and if all three tricompartmental arthritis, you're going to get a total knee replacement. If it's unicompartmental, meaning only one, that's called a unicompartmental hemiarthroplasty. There are cases where they'll do two, like the kneecap and the inner or the outer side, but that's a lot less common, or even just the kneecap area. So any of these three areas can be replaced by itself or in combination with one or all. But if all three are replaced, that is a total knee arthroplasty, total knee replacement.
Gotcha. So, what would be, I guess, compare and contrast a partial knee replacement versus knee repair, not knee replacement?
Well, whether it's a partial or even a total, the difference is that we are not putting any metal, plastic, and cement into the knee. And so, yes, there is wear and tear on the cartilage on the end of the bone, which looks kind of like the wear on the end of a chicken bone, that smooth white surface, which is kind of like the tread on a tire. When that tread, when that tread wears down, this white area wears down, that's what arthritis is. So we don't have great ways of making an 81-year-old knee back to an 18-year-old knee. There have been some studies that show that cartilage volume does increase with like bone marrow aspirate cells that has stem cells and other cells that help the stem cells. But what we do know is that when the cartilage wears down, the bone underneath it gets soft. And when the bone gets soft, it's kind of like the undersurface of a road getting soft. And then there's no support for the asphalt over the top and it breaks down, you get a pothole. Well, the same thing can happen in your knee. This bone can get soft because maybe we're older, we don't have as good quality bone, we gain some weight, we don't have as much muscle mass to absorb the force, and we don't even have as many good stem cells in our bone, in our arms and our legs as we get older, so we don't have as many repair cells. And so it starts to get soft and break down. And when that breaks down, then the cartilage is going to break down even more, and you're 9 times more likely to need a knee replacement. So with knee repair, we can take good stem cells, which you have in your pelvis area, which is in the back, not your back itself, not your spine, not your hip joint, but your pelvis, right underneath the skin, in the back of your pelvis area, above your buttocks. And we can take good stem cells from there, concentrate them, and put them into where there's not so many good repair or stem cells anymore and repair it. So we're repairing the knee instead of replacing it. And, I've mentioned this study before, but Dr. Hernigo, amazing French orthopedic surgeon, late 1990s, early 2000s. He had people who had both knees had really bad arthritis. And he said, okay, we're going to do a knee replacement on one. And on the other one, we're going to do stem cells. We're going to inject those stem cells into those soft spots and try to get those to heal. And 82% of those people who got the stem cells, or the 82% of the knees, because everybody got a knee replacement and got the stem cells. 82% of those knees that got stem cells never needed a knee replacement for 10, 15, 20 years. That's pretty amazing. So if I told someone has been told that they need a knee replacement, and I tell them, hey, you got an 82% chance if we do what Dr. Hernigo did to help you avoid a knee replacement for 10, 15, or 20 years, most people are very interested in doing that and don't want to get, metal, plastic and cement put in their knee if they can help it. So the difference is we're using your own body to heal itself as opposed to putting something unnatural in your knee.
Absolutely. In regards to um, knee replacements and knee replacement recovery, what's like the hardest part of um, knee replacement recovery?
I have not obviously had a knee replacement. I have had knee surgery, but I've obviously performed probably thousands of knee replacements over the years and now none since 2020. But I think the biggest, hardest part is in the very beginning. It's extremely painful. The first few days, first couple of weeks. So that's really hard. The rehab is very hard too, because literally the entire knee is cut open. It can be a 6-inch incision, can be up to a foot, can be maybe 4 inches at the smallest, but it's probably about a 6-inch incision. And the whole kneecap has to be moved out to the side, dislocated. And then all these saw cuts and drill holes and hammers and it sounds kind of barbaric as it's being done. And then you have to put all that back together and it has to heal. And you have a huge incision and you've cut the knee open. And so that's the rehab is I'd say the very most difficult part. And even then, after a couple of weeks, the initial pain from the surgery gets better. But now it's just all these tissues are swollen and scarred, and you have to do the rehab to kind of break through the scar tissue and make sure it stretches out and they get their range of motion back and get the muscle strength back. So the rehab is by far the hardest part. And that's months. It's months. The surgery's an hour, maybe less, maybe a little more.
Gotcha. Okay. Um, and then, not only is the rehabilitation tough on that one, but from what I understand, there's things that you can do and you can't do following a knee replacement. So, what are some things that you can still do following a knee replacement? What are some things that you can't do following a knee replacement? And how does that differ from knee repair, not knee replacement?
Sure. So things that the goals to get you back to with knee replacement is cut your pain down. And it's basically a pain relieving operation. There's a ton of pain in the beginning, but if everything goes very well, it can relieve pain fairly nicely if everything goes well. Uh, the goal is walking. You want to get you active again, doing your normal daily activities, get your full range of motion back. Now, if you have stiffness going into the surgery, you have a really high chance of having stiffness after the surgery. That's why going to the physical therapy and the rehab before and getting as much motion back as you can ahead of time is so important. So if just getting a knee replacement isn't going to make your knee less stiff.
Yeah.
It's the rehab. So, you get that motion back ahead of time, but the goal is to get you hopefully better motion afterwards if you can, but that's very difficult to do sometimes. I mean, but getting back to non-impact loading exercises, that means exercises where you're not running or jumping or cutting. And so golf is fine, bowling is fine, tennis is fine. Yes, you are kind of, jogging around playing tennis, but you're not going for long, long, long runs. Like going running for the sake of running is not a good exercise with a knee replacement. Not that you can't do it. I mean, you can do it, but metal and plastic and cement, it's going to wear out and loosen up over time or crack or break. And you're going to need another one of these. Once you get this, you're never going to not need this again. And to do a revision is very, very, very difficult and much more risky and not as successful. So you don't want to be pounding on it, jumping on it, playing basketball. Do I know people who do that? Yes. But Bo Jackson is a great reminder of that. He had a hip replacement. He went back to play Major League Baseball. He wore that thing out in no time. I think he's had at least 2 or 3 revisions. Obviously, he's never been himself again. Not that it was his fault that he needed a hip replacement. He had a bad injury playing football, but you can't play. Speaking of which, like you shouldn't be playing football or contact sports or things like that. So kneeling is very difficult too. Not that you can't kneel with a knee replacement, but it's very difficult in the beginning because there's a big incision in the front, and even over time, people don't like kneeling on that. Also, when you're kneeling on it, you're literally compressing that kneecap up against this, metal against plastic. It's probably going to be a little more likely to wear out or loosen. Um, but it's more like people, they can't kneel. Whereas with a knee repair, we're not putting metal, plastic, and cement. We're not doing any incision. We're just doing poke holes. So kneeling is usually not a problem at all. Walking, we want people to walk. We want people to do all their normal daily activities. We want people to get back to pretty much everything that they've ever done. Now, having said that, it depends on how much arthritis is in there, whether or not we would necessarily recommend, running or running long distance either. But at least if you started running with your own parts and your knee got worse and you wore it out worse, you can always get a knee replacement. If you get a knee replacement and you start running and you wear it out, you can't you're going to have to get a revision knee replacement or, a much harder, bigger surgery. So I think the knee repair, not knee replacement, much less invasive, just poke holes versus a big incision, much quicker recovery. You walk in and you walk out. You definitely don't do that with a knee replacement. And if you do, it's because they numbed you up and the anesthesiologist gave you a nerve block and it's kind of faking it, it's covering it up. But the next day you're feeling it or the day after. And then As far as time off from work, a lot less time off from work with knee repair, not knee replacement. People feel as though their knee feels more normal because it obviously is. It's your own knee. And Dr. Hernigal found that in his studies as well, that the knee that had the knee replacement versus the knee that didn't have the knee replacement, that had the stem cells, that stem cell knee felt much more normal than the knee replacement knee, even when people were doing well with their knee replacement because they had both knees to compare to. That's why that was such a cool study. And so I hope I answered that question because I've kind of gone around in circles, but really, knee replacement, no impact loading activities, whereas knee repair, not knee replacement. Once we get that bone to heal, a lot of times, yeah, you can get back doing impact loading activities. But again, every case is different. And so that's why we personalize everybody's case and figure out what their goals are.
Absolutely. All right. So you said something in there about getting back to work, and one of the questions that I had here was, can I go back to work 2 weeks after knee replacement surgery?
And again, it depends on what type of work it is. There's absolutely people who can go back to work 2 weeks after if they're at a desk job and they're just sitting, if they're working from home, if they're not doing, any type of a physical labor job. But a physical labor job, no, that's going to easily take at least 3 or 4 months. If you're a lineman, if you're a corrections officer, police officer, firefighter, um, anybody who needs to really use that joint and has to maybe stress it out, you're going to be 3 or 4 months at least. But uh, 2 weeks for light duty work, almost everybody, sedentary work or light duty work, we would allow that. So I would say some people, it depends on their job. If their job does not require a lot of force or effort with that knee, they can go back in 2 weeks. Other people, if their job does, well, they can at least go back light duty at 2 weeks.
Gotcha. And how does that compare to someone who goes through knee repair, not knee replacement?
Yep. It's I'll give you my example. I had it performed on my elbow on a Monday, and it was pretty sore for a few days. And then Friday, I operated and did surgery, and I have to use my arms and my hands to do surgery. So I didn't miss any time from work at all, zero. And we find that a lot. Now, again, if it's somebody, it depends on how extensive what we had to do as well. Everybody's different, but in general, we do like you to kind of, if you have a physical job, we do like you to kind of take it easy for a couple weeks, but it's not going to be 3 or 4 months till you get back to full duty activities. It might be 6 weeks. It might cut that time in half. Sometimes it's 2 weeks. Sometimes it is 3 months, but it's usually not longer than that. So most of the time, I would say, and you are involved in rehabilitating these people as well. It's probably like 6, 8 weeks. It's probably half the time at the bare minimum to get back to full duty than it is after a knee replacement. It cuts it in half at least, I'd say on average.
Yeah, yeah, absolutely. Of course, in my experience, that's what I see as well. And honestly, what I hear from a lot of people is that the financial component of that is really important to them, like being able to get back to work sooner than, if they had a knee replacement. So, um,
Yeah,
always,
I
always
mean, I
important.
mean, I never forget it. Like I had people that we performed knee repair, not knee replacement on during COVID when we couldn't, that's why I stopped doing knee replacements because COVID hit and the hospitals and the operating rooms shut down, so we couldn't do surgery. I had a bunch of people scheduled for knee replacements or wanted knee replacements, and we couldn't do it. So we performed the knee repair, not knee replacement program with them, and we tried to get that approved through COVID emergency use through their insurances. And the insurances is kind of weird. They were like, well, yeah, go ahead and do it and then submit it. And we're like, well, we want to know ahead of time. So these people, they might be paying thousands of dollars out of their own pocket, just like you would pay for a knee replacement if you had to do that out of your own pocket.
Right.
And they said, well, just go ahead and do it and submit it. So these people were fully recovered in 3 months and were doing amazing. And that's one of the reasons why I switched from doing knee replacements to doing these programs. But it took about 6 months to get the insurance, the information back from the insurance, after going back and forth and them denying it and saying send more information. And eventually they said they were not going to cover it. And so I had to go in the room at 6 months and tell these people that your insurance isn't going to reimburse you for what you had done. But to my surprise, they were like, "Oh, I don't care. I didn't miss any work. I actually saved money because I was able to keep working. My buddy down the road had his knee replacement. He is still limping around. I'm doing, so that's the type of thing where people don't realize until they actually go through it that they're actually maybe going to save money because they'll be able to work and not have to miss all that time from work."
Right. Yeah, and I think that's an important piece too, what you said about the guys whose buddy was down the road, he was still limping, is that just because you get a knee replacement, that's not going to solve the functional impairments like the limping, the poor gait, things along those lines. But the knee repair, not knee
It's
replacement
not, yeah,
program,
yeah.
you know,
I mean, it's gonna take longer and be harder to fix those functional impairments for sure. Yeah, absolutely.
yeah. Um, this is maybe from a surgeon's perspective, you can answer this one. Obviously, like you said, you haven't gotten your knee replaced, but from what you've seen and from your perspective, is life better after knee replacement? Is the question.
I would say for the majority of people, yes, absolutely. It's a lot harder and longer process to go through, but absolutely. I mean, Dr. Murray was my chairman at SUNY Upstate, and he's one of the original developers in knee replacement, and that was in the 60s. And it was an amazing invention back then, and it's still pretty amazing technology. And the technology's gotten better. The overall, it's still metal, plastic, and cement. The technology's gotten a bit better, but it's still, it's like 60s, 70s technology idea, but it's still an amazing thing. It's just like rotator cuff repairs, we used to cut the whole shoulder open and do a huge incision. Now we just do it through little micro incisions. Now sometimes we get it to heal without even doing a surgery. The goal is the goal of any surgeon should be to either prevent surgery or do it as minimally invasive as possible. And I just like to use like the Star Trek example, like Bones McCoy, the doctor. He had a tricorder. It was a machine that could diagnose things without, diagnose what was wrong with the patient without needles or shots or electrodes, and then it could cure them with it. And so, we're getting closer and closer to using biologic methods instead of metal, plastic, and cement. And so, even though life for most people after a knee replacement is good, it can be very bad as well. Meaning, if you're one of the people that the 15% of people that it fails on, then you have no option other than metal, plastic, and cement. If you're one of the 30 or 40% of people who still has pain, there's really no option for getting rid of that pain um, because it's metal, plastic, and cement. So what the surgeon will say, well, we can always do another knee replacement on you. You're like, I don't want to go through that again. No guarantee it's going to get rid of my pain. It might make my pain worse. And then, I mean, I hate to use this example because it's hard for me, but it's my dad had hip replacements, and you're never not at risk for having a problem even years down the road. So 9 years after he had his hip replacement, he developed an infection in that hip replacement because if you look at these, this looks smooth, but even if you looked at that under a microscope, it has all kinds of little cracks and crevices, and the undersurface does. And so bacteria, maybe they come in from your teeth, from a teeth cleaning. Maybe they come in from a toenail infection. Maybe they come in from a urinary tract infection. Maybe you get pneumonia and bacteria gets in your body and it loves to go to artificial areas. So it goes to the knee replacement or the hip replacement and it causes an infection. So he had developed an infection in his hip. They think it came from his mouth. They don't know where it came from. And it became so severe that they had to take everything out, leave the incision open because every time they tried to close it, it would still get infected. They were never able to put metal, plastic, and cement in. And it took 6 months for that huge incision that looked like a shark bite to slowly heal on its own with multiple dressing changes over months. And he lost his independence, and he was a very independent man. He loved to golf. He absolutely loved golf, and he couldn't golf, and he had to be in a rehab center. He couldn't be in his own house, his own bed with his wife. It was very difficult. And it took like a good 6 months at least. And still, after that, they were never able to put another hip replacement in because they were worried it was going to get infected. So his leg was 4 or 5 inches shorter. and he never got back to golfing. And it was really, really, really hard for him and for us to go through as a family. So, I mean, you don't hear of any of that happening with knee repair, not knee replacement, because we're not putting metal, plastic, and cement. It can be years down the road. You're not going to get suddenly get an infection after we did stem cells on you 5 years ago. So that's the thing. Like the risks, if you get a blood clot in your leg, like one-third of those will present with you dying. You don't even know. Like it just breaks off, goes to your lungs, and you're dead. So there's some really, really significant risks with knee replacement. So can life be better? Absolutely. But the risks are so much higher. And if you have an 82% chance of not needing a knee replacement by using biologic methods, why do the knee replacement unless you've failed everything else? And that's my point. You can still have life is good, but in the back of your head, hey, I could still get an infection this, or I could fall and break my knee replacement. Now that's a huge, massive, very difficult surgery. I could still get an infection. I could still get a blood clot. I could still all kinds of things that can still happen. And it's going to wear out at some point. So it's like a ticking time bomb. It is going to wear out 10, 15, 20, maybe 25 years. But if you're 50 when you get it, you're going to get another one down the road, and that's going to be no fun.
Yeah, for sure. Yeah, those risks are definitely a concerning thing for sure. From the patients that you've seen that have gotten knee replacements done, what's the biggest complaint that they have after getting a knee replacement surgery?
That's a great question. I think the biggest complaint that they have, I mean, it's probably the most common complaint is they still have some pain. It's different. So it's like, oh, I still have this pain or stiffness feeling to it. Sometimes even swelling. They don't like this because you're putting this metal, plastic, and cement into somebody. That knee's always going to be a little swollen because it's unnatural.
Right.
And it's just bigger. And so women particularly, they don't like the fact that that knee looks different than their other knee. I mean, it also has a big incision. So cosmetically, I'm not saying only women, men too, but I mean, you notice it more in a woman who's got maybe, wearing a dress or a skirt or something, and they don't like the fact that one knee looks different than the other knee. I'd say the most common complaint is still probably pain. Stiffness is probably number two. Number three is maybe I can't do some of the things that I used to be able to do. Like my pain's better, doc. I really appreciate that. But, I can't bowl anymore because I really can't bend that knee when it's my left knee and I'm a right-handed bowler. And it's too stiff to do that. Or, I just can't. I always loved to run before. I loved to hike. I loved to play tennis. And I can't do that anymore, or I have difficulty going up and down stairs. It doesn't hurt as much. So they're usually kind of like justifying it feels better, but I still have some pain, or it feels better and I can't do this. So pain, number one, lack of function, number two, like or stiffness, and then number three might be cosmetic. I mean, that is a complaint sometimes. And you do get most of them get numbness as well. So the incision is right in the front of the knee. There's a skin nerve called the infrapatellar branch of the saphenous nerve that comes right across the front of that knee. You almost can't avoid it when you're making that incision. So they almost always have numbness on the outer side of the knee. And that's very common. And it's not a major complaint, but it is a complaint.
Yeah, definitely something you'll notice.
Yeah, they notice it, especially kneeling. That's another reason they hate kneeling.
Yeah. Um, why is there still so if a knee replacement is a pain relieving surgery, why is there still instances where people continue to have pain after getting a knee replacement?
So a knee replacement is a pain relieving operation, but people still have pain. Why is that? It's a different type of pain. So you're getting rid of the arthritis. There's no arthritis in that knee at all anymore because arthritis is nothing more than the cartilage wearing down. So you cut all the cartilage off. You can't have arthritis anymore because there's no cartilage left. You're putting metal, plastic, and cement. So, and a lot of the pain from arthritis comes from the underlying bone. So now you're putting metal, plastic, and cement, and that's pretty much protecting that bone underneath from any excessive force. And so you're really not getting that same bone pain or that same arthritic type pain. But the pain, I think, and you being a total body fitness rehab specialist. I want you to weigh in on this, but I think it's more soft tissue pain. You're making a huge incision through all the tissues, all the way into the knee. So skin, fat, tendon, muscle, even bone and cartilage, and you're moving that kneecap over, dislocating it, which is very traumatic to a knee, dislocating this kneecap. And now you're putting it all back together, and there's a lot of scar tissue and stuff in there. And just that gives pain. When you're cutting through that much stuff, all those areas have nerve fibers in them, and they're all going to react. And I think a lot of the pain afterwards is more soft tissue pain, which is kind of good and bad because people say to me, "Well, if I've had a knee replacement, then you can't help me." And I'm like, "Well, we can still help you. We can't repair that knee instead of replacing it because it's already been replaced. But the same principles that we use to help tendon problems and muscle problems and tendonitis and ligament sprains and all those things like bursitis, inflammation, soft tissue problems, not bone or cartilage, regenerative medicine can help with that too. PRP, platelet-rich plasma, bone marrow aspirate cells that has stem cells and other cells that help the stem cells, laser especially. When we first got our laser in 2017, and that was the only thing we had other than PRP at the time. We had a lot of people with knee replacements that would come in and they say, my doctor said I'm going to need another knee replacement. Is there anything else I can do? We would do laser on them, and that would help tremendously because it increases blood flow, which makes that scar tissue more pliable. And if you stretch the scar tissue out like pizza dough, it's going to eventually stretch out and stay that way. It takes time, like pizza dough does, but then they're going to feel a lot better. So I think most of the pain that they're getting is soft tissue pain, not bone pain, and definitely not arthritis pain because you can't have arthritis. The knee there's no cartilage in there anymore. So it's soft tissue pain, and we can still help that with our programs, and we do help people who've had knee replacements. So just because someone's had a knee replacement doesn't mean we can't help them. We would like to avoid that in the first place, and we would like to avoid them from even getting arthritis in the first place. That's our ultimate goal. But we can still help people even after they've had a knee replacement. So if anybody out there ever asked that question, if you've had a knee replacement and it's not, infected or getting loose, which there's ways we can test for that, man, we've helped a lot of people out with pain after a knee replacement, and that's probably an underreported thing that we don't talk enough about, and we probably should because there's millions of people out there with painful knee replacements, and we help them all the time. And I guess I probably will say that I don't talk about that enough, but I probably should.
Well, then it was a great question, I guess.
It
Um,
was.
so I got one more question on my list, and I'm going to say the question, but then I'm going to expand on it a little bit. So it's something that we've already answered a few times, which is, are there any alternatives to knee replacement surgery? Um, and you could briefly answer that, but I also maybe want you to expand on what's the most impactful story that you've seen of someone who has undergone knee repair, not knee replacement, instead of undergoing a knee replacement.
So what was the first part of that question one more
Are
time?
there any alternatives to knee replacement surgery?
Yeah, absolutely. So obviously knee repair, not knee replacement. And there's components to that. There's regenerative medicine components like things like PRP, platelet-rich plasma, which we talked about. Bone marrow aspirate cells that has stem cells and other cells that help the stem cells. The cells do the work. The PRP is more like fertilizer that helps the cells. I'm just simplifying things. We talked about laser. There's different types of laser. There's healing lasers, class 4 laser, MLS laser, the safest laser you can have. It will not burn somebody. A lot of class 4 lasers out there. Well, I'm going to go to so and so and get a laser. Well, that laser has the risk of burning you. And whereas MLS laser, the one that we utilize, that's sold by Cutting Edge Lasers. I'll give them a plug because they're amazing. And ASA Laser makes it in Italy. And then Cutting Edge Lasers, they are the North American distributor, and they're not too far from us, right in Rochester, New York. And they're a great company to work with, but they care about so much about safety and patient outcomes. And so laser is a great other alternative to knee replacement. And then, you know this, a lot of therapists, they're in the insurance realm, and the insurance is like, hey, you got to see, I mean, it doesn't tell you this, but it forces you to see 20 or 30 patients in a day because you're only allowed to look at the knee. unless the prescription says other areas. And a lot of times the insurance won't pay for multiple areas anyway. So, you're just looking at the knee. Well, what about the hip that's causing the knee problem, or the back that's causing the knee problem, or the ankle? We do VFit, Victory Fitness, which is a total body fitness strength and conditioning program. And as you know, that has massive effects on helping out someone who has knee problems, because if you fix the mechanical problems, that's going to take the pressure off maybe the part of the joint that's getting the pain, or the soft spots in the bone. But also, the stronger your muscles are your main shock absorber. So what your muscles don't absorb, then the joint has to absorb the cartilage and the bone. And if that cartilage and bone is damaged and your muscles are weak, it's going to be a bigger problem. So getting your muscle strong is going to take the pressure off those damaged areas, fixing your mechanics. And then we didn't even talk about this, but losing weight. I mean, every time you walk, you land with about 3 or 4 times body weight. So everybody needs to lose 10 or 20 pounds, right? So if you lose 20 pounds, and that's 4 times body weight, that's 80 pounds per step that you're saving. Go walk around, grab 80 pounds and walk around with it for a couple hours. You probably can't. Like, imagine taking that much force off your knee. It's going to help a ton, and your back and your hip and your ankle. So just losing some weight is very important from a mechanical standpoint and from a physics standpoint. But also, you know this as well as I do because you're in charge of our V-Slim program, but fat causes inflammation. So you can be the right weight, but if you have less muscle and more fat, you're still going to be inflamed. And even though you don't look like you're overweight, you still have a problem. You have an inflammatory problem. And obviously that can cause problem with your heart disease, diabetes, cancer. But selfishly, from our standpoint, it affects our joints negatively. Inflammation is bad for our joints, and it gives us pain, and it causes our joints to wear out. So we have a different type of laser, a red light laser, that will actually, there's certain wavelengths of light which will open up the pores on our fat cells. Our fat cells actually have pores. So the fat cells open up, and the fat cells store fat. And then when those pores open, the fat drains out, it goes into our lymphatics, and we eliminate it naturally, which is amazing. It sounds like science fiction, but it works. As you know, it's just amazing. People lose 30 pounds of fat in 3 months. It's just amazing. And so, yeah, the side effect and benefit of that is you might lose some weight if you need to. But even if you don't need to, quote, lose weight, matter of fact, you know this, you can gain weight by gaining muscle mass, because muscle mass is heavier than fat. So you can actually gain weight and become much more healthy, right? Because you're increasing muscle, decreasing fat. So it's not about weight, it's about decreasing fat and inflammation. So all those things are amazing alternatives to this metal, plastic, and cement. Um, the most impactful story, we've had amazing stories, impactful stories. I mean, I don't know. The one that comes to mind, I guess, for me at first, just is because she was one of the first ones. And I just talked to her the other day, and she's almost 3 years out from her knee repair, not knee replacement. Her name's Diane. And if you've seen any of our social medias, she's amazing. But I talked to her, and I'm writing a book actually, and I want her to be a story in the book. So that's another reason why she's top of mind. So I'm writing a book about this, and so all of you out there, be ready for the book at some point. It's going to have a lot of impactful stories in it, and she comes to mind because I was talking to her, kind of interviewing her, making sure I understood her story, which I thought I did. But the interview stopped, and then we just started talking. And she was talking about all these bad things that happened to her in her whole life. Like she she put her head in a beehive at one point when she was a kid, and she got stung and really messed up. She was 7 years old on a boat, and she was in the back of the boat, and the engine caught fire, and all the adults were in the front, and she's surrounded by fire. She's feeling herself getting burned. Her instinct is to jump into the water, and the adults are in the front of the boat telling her to stay put. And she's like, that doesn't make sense. And so suddenly the flames go down for a second. They all scream to her to run. So she runs. The boat was at the dock, actually. She gets on the dock, and the boat blows up. So she also was in two different car accidents, where she smashed into a windshield. She also dove into a lake, and it was at night, and it was too shallow, and she broke her neck and was in traction for 3 months. She got bucked off a horse. She got flipped around, the saddle flipped around, so she was under a horse one time, hanging on for dear life, like all these crazy things. And she said, I've always been told that I had 9 lives. So what is my point about this? My point is she was always very active. She traveled, and as she got older, her back was bothering her more. And so she didn't travel as much. So her friends socially got her together and said, "We love going to yoga." So they would go to yoga every week. And it was a big social get together, but she also just loves the exercise of yoga. Suddenly one day, 3 years ago, her left knee started bothering her. No rhyme or reason, no injury or incident. Maybe, she got the stress. Well, we know she got the stress microfracturing in her bone. Um, we don't know why. And so she was having severe pain. She couldn't walk her dogs, loves her dogs, and she couldn't do yoga. So she literally was like, I think, if I can't get back to yoga, then this is my ninth life, and I don't want to live. She was that it was meant that much to her. So she thought she had finally reached her ninth after going through all those much more traumatic things, or maybe we think they are. I mean, having knee pain and losing your independence and mentally and socially, to her, that was even more important than any of those other injuries or incidents that happened. And she was really upset about it. And she found out about our knee repair, not knee replacement program. She had the courage to go through it. She said, I'm all in. I'm going to do it. And what's amazing about her is she literally said, and I haven't really had this happen with anybody else, but she said, right after I got off the table, after you did the injections into my knee, the bone marrow and the PRP, she goes, I felt better immediately. We do occasionally get that, but in general, that doesn't make a ton of sense. It should start feeling better within, a couple of weeks for sure. But I think one, maybe the anti-inflammatory effects of the PRP sometimes can kick in pretty quick. I don't know about that quick, but my other thing is I think mentally to her, she was just like, I've been through so many of these other things. That wasn't that bad. Like that was really, she said it was so easy to go through. And so I think mentally, the power of our mind, like she was already better. She was like convinced I'm better. And if someone's all in and the power of the mind and the mental is so big, it can be so negative, but it can also be so positive. And for someone to get that much better that quick and then really fly through the program, within 6 weeks, she was doing all her yoga poses again. She's now 3 years out and she's 100% and no issues with her knee. And to me, that is a very impactful story after all she's been through. And so that's kind of the story that I guess I'd like to leave with.
Yeah, she's an amazing person for sure. So glad that we were able to facilitate help in her life and keep her moving. So um,
Dogs are
well,
very happy about that too.
yes, she was saying that when she came in to talk to you. Um, but yeah, so well, thank you very much for answering all those questions today, and thank you to our fans and followers out there on social media for submitting those questions. If you have a question you would like to Dr. P to answer, be sure to join our Skool group, which is linked in the description below. Um, as of the date of this recording, it is free to join, so make sure you get into that group and ask away. There's some rules in there that you could follow and read, but uh, there's a ton of information in that group. So join our Skool group.
Yeah,
And
I can't agree more. First of all, thank you. Great questions. Thank the people who submitted the questions. I mean, we get, as you know, we get a ton of questions on especially YouTube and TikTok, but we get them on all our platforms, including Instagram, Facebook, LinkedIn, but especially like TikTok and YouTube, we get a ton of questions. Um, I think if you can join, for all you people out there, keep sending your questions in, but I would say join this group because it's an amazing group and you can ask your questions live. I would love for someday to have it where you are all up there with us, Adam and I. But a lot of people are shy and they don't want to do that. That's fine. A lot of people submit their questions and watch the video later on. That's okay as well. But we would really like to have more of a group discussion and I think you would get your questions answered a lot more extensively. But these are great questions. Keep them coming, and I'll keep answering them. Thank you.
absolutely. And be sure to follow us on social media at Victory in Motion One, and be sure to follow Dr. P on social media at Dr. Marc Pietropaoli. Um, we will see all of you on Ask Dr. P next Wednesday.
Hi, thank you.